Welcome to Living Fully. Each episode is a chance to talk about mental health in a way that's simple, honest, and helpful. We'll share stories, tips, and tools to help you feel supported and feel your best. I'm your host, Catherine Hertig. In this episode, I talked to psychologist Lisa McIsaac about the complicated emotion of shame, how it's different from guilt, and why it's such a universal yet tough topic to talk about. We'll chat about where shame comes from and how it can impact your mental health and relationships. We'll also explore ways to work through shame, from practicing self-compassion to opening up to someone you trust, and even using it as an opportunity for growth. Well, welcome back, Lisa. Thank you for being here today to talk about shame.
Thank you. Thanks for having me.
When we talk about mental health, we're often talking about the different emotions we feel and how they can affect us. And so in this episode, we're going to do a deep dive on the feeling of shame. So what it is, what it feels like, how we can validate it, and what we can do about it. So Lisa, it's been a couple episodes since you've been on. Can you refresh our listeners and tell us a bit about yourself?
Yeah, of course. My name is Lisa McIsaac. I am an Associate Director of Counseling Services here at Calgary Counseling Centre, and I'm a registered psychologist.
Excellent. Thanks so much. It's a very interesting topic.
It is an interesting topic and one that oftentimes I think makes people uncomfortable. So I think It's a great conversation for us to have.
Yeah. Let's, start with the basics. What is this feeling of shame, and how does it kind of differ from guilt?
Shame and guilt are complex emotions, that often intersect and can generate many responses and cognitive distortions. So simply put, guilt stems from I did a bad thing.
Okay.
So it's behavior based. An example could be, a child, they stole something.
Yeah.
And so there's like a moral transgression or a wrongdoing. Whereas, where an action or a behavior might be in contrast with like a social norm or a value. Unlike shame, which focuses on feeling like a defect to character, shame is about a person's identity. It's about a person's character, worth, and or value. So shame is a deep-rooted sense that the client is bad. So guilt is I did a bad thing. Shame is I am the bad thing.
Okay.
Shame is a deeply distressing, uncomfortable emotion. And it typically arises when we feel like we've made a mistake, and it involves feelings of inadequacy, negative self-evaluation, self-consciousness in response to an event or something that's happened in our lives.
And why do you think that shame is such a universal emotion? I mean, I'm sure everyone listening has felt that at some point.
Yeah, it's personal. I think everybody feels shame, but it's often rooted in trauma. Is it not talked about? There may be cultural or religious constructs that are confusing. An individual may be afraid. They might be afraid to disclose for fear of rejection. They may not feel safe to express their emotions or disclose their feelings, and talk about the events that may have caused them. And they may have been led to believe that they're to blame for the events that underlying the shame.
Yeah. How can you personally, how could I tell the difference between feeling guilty about an action, about something I did, and feeling shame about who I am?
Yeah, I think that someone who feels shame, they feel that internally. It's deeply rooted. They may isolate, avoid contact with other people. When they're talking to you, they might avoid eye contact, be afraid of saying or doing the wrong thing, a lot of hypervigilance, and may manifest in low self-esteem, insecurity, avoidance, like you can't be your true self.
Yeah.
Feeling really inauthentic and bring about feelings of inadequacy. Guilt's usually event-based. It's usually not long-lasting. It's fleeting.
Okay.
Could result in like acts of omission. They're quite a bit different.
How does shame develop? Are we born with it, or is it something we learn over time?
Well, that's a really good question. Research indicates that shame is evident in babies and animals. So,
is it?
That would lead us to believe that it's innate.
In animals?
In animals, like monkeys. Yeah, they've done research on babies and monkeys, and they say that they experience shame.
Wow.
Yeah, it has an origin in the long-term survival of our species. So harmful shame can begin when we are really young, right? So children are less able to separate feelings from their self-image. So when a child experiences bad feelings, they may also come to believe that they're bad. So that creates insecurity and confusion about how to express painful emotions.
Yeah. And so you said bad shame. So is there a healthy or constructive side to shame, or is it always negative?
I think there is a healthy and constructive side to shame. I think healthy shame aids in normalizing behavior, which teaches us how to coexist with others. Like, it's deeply rooted in faith and in cultural beliefs.
Yeah.
Shame can make us humble, right? It can provide humility and teach us about boundaries. And without healthy shame, we have no way to understand really how our behavior affects other people. Mm-hmm. Shame can have meaningful purpose in aiding in the development of social order, right? So helping people to differentiate between social constructs of right and wrong and good and bad.
Yeah. Are there common situations that can trigger feelings of shame?
Shame can be triggered by memories of past traumatic events and loss, perceptions of fear of judgment, right? So, being judged by other people, fear of rejection, abandonment, if those are people's experience, financial insecurities, inequity, low self-image, not fitting in, having to engage in social situations and being uncomfortable with answering personal questions for fear of being judged in those situations, sexual orientation, gender stereotyping, toxic masculinity, being a victim of intimate partner violence. There's so many things, like the list goes on.
Yeah, that's a long list. Mm-hmm. Yeah. And the first one you mentioned about trauma, what's some examples of a trauma that could lead to shame?
Some of the origins of trauma, that we might see in therapy might be shame that a person experienced when they witnessed domestic violence, having a difficult childhood. So that could be situations of neglect, bullying, abuse, physical, sexual, or emotional abuse, a family history of mental health issues or addiction issues, experiencing loss. Loss can be very tragic for some people, especially if it's the loss of a parent to a child or a child for a parent. Like, those are non-normative and can be very traumatic. Low self-esteem and negative body issues, or having a pre-existing illness or a mental health issue.
Okay. Why does that fear of being judged socially or being criticized, why does that often bring up feelings of shame?
I think a person's self-worth is determined oftentimes by external factors. Like, we develop our identity in relationship with other people.
Yeah.
If you think about as a child growing up in a family, you were seeking validation and feedback from your parents, and your siblings and the people in your environment to determine whether or not you're good, right? Am I good? Am I pretty? Am I smart?
Yeah.
So our self-worth is based upon the perception of other people and whether or not we felt accepted by them. So feeling different from others, less than, or judged can exacerbate underlying feelings of shame and inadequacy.
Is there a kind of a healthy balance there? And how do we move towards that? Because it's like, at a certain point, it is, you do care about what other people think of you. Mm-hmm. But you don't want to go too much in either direction, right? You can't, determine your self-worth, but you can't reject, the perception that other people have of you. Does that make sense?
Yeah, it does. And it's really complicated. I think as children, we're quite egocentric, so we internalize everything that goes on around us as though it's about us, and formulate your identity based upon that. And if you're in a very positive and nurturing environment, then that's a good thing, right? So you want to take those perceptions and that validation,
right?
Because it's positive and it's going to grow you in a productive way. However, if you're in a negative environment with a lot of trauma or neglect, that feedback that you're getting is not good. So as an adult, you need to be able to differentiate between positive and negative feedback, and also be able to be constructive and objective about what you want to receive and accept for yourself. So there's a bit of a cognitive process in that. And there needs to be a healthy foundation for your self-esteem, I think, in order to be able to work on that. So it's different for different people.
Okay.
And I think part of it too is moving from being a child where you're internalizing, that external feedback, to an adult where you can critically observe the actions of other people and also attribute some of the negative perceptions to them and not necessarily take it on and make it about you.
And most of the time, does that just come with time and age and experience?
Yes and no.
Yeah.
I think if you have a healthy self-concept, yes. And if you don't, then maybe not.
Right.
It might be a little bit harder. And that's where therapy can really help navigate that.
Okay. And this has come up a little bit. So what is the role that family or culture play in shaping how we experience shame?
Yeah, cultural attitudes toward vulnerability and emotional expression, interpersonal relationships, influence how individuals perceive and navigate complex emotions. So familial and cultural values, beliefs, and ideologies and expectations shape our perceptions of ourselves, the world, our roles and responsibilities, our expectations, and our value. So this is often evident in gender roles in different cultures. And,
Okay.
and that varies too, depending upon the family and the culture, right? What that expectation might be around gender role, sexuality, social status, and again, things like financial inequity, feelings of inclusion, exclusion, safety, and belonging, So we're, and whether we're in a collectivist kind of culture or an individualistic culture.
So if we've kind of grown up with these ideas that kind of lead to shame, how do we recognize that? And what are steps that we could take to change those beliefs?
Yeah,
I bet that's kind of a complex question.
It is a complex question. It's a complex question because I think that, the shame, because it's characterized by a deep sense of inadequacy and unworthiness, can be really, really hard for a person to navigate seeking help or asking for help.
Yeah.
So some people suffer in silence, for a very long time. And, what's important is for people to know is that you're not alone. Everybody experiences and feels shame, and some people to different degrees. And, reaching out and asking for help is really important to be able to work through those issues and, to find more adaptive ways of coping and to incorporate more helpful ways of thinking and more helpful perceptions, and to be able to establish, your own identity and your own value system separate and apart from, what's been normalized to you in your environment.
Yeah. I could imagine that would take a lot of work.
Yeah.
Lisa, how does shame affect our mental health and self-esteem over time?
So that's, it's an individualized kind of question because it affects everybody differently.
Right.
Yeah, but on a more global level, I would say that being marginalized, creates systemic discrimination and social stigma. What
do you mean by it? Yeah, sorry. You're going to explain yourself.
So being marginalized, if being marginalized means if you're in a vulnerable group.
Okay.
Cultural, if you're a cultural minority, if you maybe have a disability or a cognitive disability, or you might have your sexual orientation, might put you in a marginalized group. So or financial inequity, if you're experiencing poverty or addiction or houselessness, being marginalized creates systemic discrimination and social stigma, which can exacerbate feelings of fear, shame, and guilt. Fear of discrimination or violence based upon race, gender, sexual orientation, or socioeconomic status, can contribute to hypervigilance and emotional distress.
What's hypervigilance?
Hypervigilance is, when you think about your startle reaction,
Yeah.
Hypervigilant is when you're hyper alert to what's going on in your environment and, really attuned. Usually people who are hypervigilant, they are always on the lookout for things that might pose a risk to their safety.
Yeah.
And people who have experienced trauma and PTSD tend to have a lot of hypervigilance.
Okay.
So oftentimes people may say, oh, I'm really attuned to my environment, but that could mean, you've had a past experience with trauma and you're just really good at reading a room and being conscientious about what's going on around you.
Yeah. Mm-hmm. So from what you've said, I would assume that shame could lead to other mental health issues, maybe like anxiety or depression.
Oh, yeah, absolutely. Yeah. I would say that, shame oftentimes leads to, more mental health issues like anxiety or depression. And, it can result in behaviors like being more withdrawn or isolated, shut down, so people can be lonely, and or overly sensitive, or they could strive towards perfectionism to try to fit in, become high achievers or people pleasers. And those behaviors in and of themselves, can have long-lasting effects on people. Mm-hmm. So, and in cultures like ours where people focus on autonomy and self-expression, like fear of failure and guilt for not achieving could attribute to people's mental health issues.
Yeah.
It's quite complicated.
I've heard this term of like the cycle of shame. What is that? Like, what does it look like and why is it kind of hard to break out of that?
Yeah, so the cycle of shame refers to like a range of negative emotions in response to a person's experiences.
Okay.
So when they believe they've done something wrong or bad or something bad has happened to them, it can exacerbate shame and reinforce negative beliefs about the self, which increases depressive thoughts and sadness, anxiety, self-doubt, negative feelings like anger. So those things are all reinforce more negative thoughts about the self, right?
Right, yeah.
So I've done a bad thing. I am a bad thing. I'm stupid. I'm not worthy. I'm not lovable. Like all of those negative thoughts, and ruminating on things like that. It's like a snowball effect.
Yeah.
They just grow. And shame is a relational experience when a person feels differentiated and like they don't fit in or they are not worthy or they're not good enough or they're afraid of being rejected. They tend to isolate, withdraw, shut down, and it can be really hard to break those patterns. Mm-hmm. And the more isolated and withdrawn, and that lack of engagement tends to just also reinforce those negative feelings about the self. So they're... it's quite debilitating.
Yeah. Okay, so let's get more positive about this. What can we do about it? So how can we acknowledge and validate feelings of shame without having it define who we are?
Right. So, first and foremost, I think it's about increasing understanding. It's about a person understanding like why and how you came to be here. So oftentimes when individuals come to me who have a lot of shame or a lot of trauma, I try to normalize their experience because most often people have had a history of being pathologized, right? Like what's wrong with you?
Yeah.
And there's nothing wrong with them because if you took 20 other people who had similar experiences and you put them in the room, they would show up similarly, with similar presenting problems. So I educate and normalize those experiences and the impact for people. If you're feeling this way, it's because of the experiences that you've had. It's not because of you.
Right.
And that other people who've had similar experiences would show up like you. So just really normalizing how they feel in their presentation and attributing the bad thing to what happened to them, not them.
Yeah.
I think that's first and foremost. And helping people have self-compassion. It's just being gentle with themselves and having that self-compassion.
What does that look like? Like when you're working with a client, how do you help them build that skill of self-compassion?
Oftentimes I would ask somebody, if they had a friend who had that experience, how would they support that friend? What would they have to say to them? And how they would address that situation with someone else is often vastly different than how they would address it with themselves.
Yeah.
And it's eye-opening for people. So I try to work with people from a be your own best friend kind of perspective, help them increase their awareness about how they show up for other people and, how they view other people who have experienced adverse events.
Yeah.
And then trying to put that into perspective when it comes to themselves, So why aren't you deserving of this kindness? Why aren't you deserving of this acceptance? And, it really shifts that perspective for people.
Why is that so often our go-to, is to be like so much harder on ourselves than other people?
Yeah, that's a really good question. I think that as human beings, we seem to be, by default, oftentimes be harder on ourselves.
Yeah.
But I also think that there is a societal construct around that also. There's a lot of conflicting values and belief systems that we learned growing up. And I mean, some of them that I think about is, don't lie, but don't say anything and hurt someone's feelings, so it's kind of like, it's a conflicting belief or, you need to take care of other people and be really kind, but don't be selfish, and
right. We're given these conflicting messages.
Yeah. So, it's like, let's prioritize other people, but not yourself. Right?
Yeah.
So don't practice self-kindness is almost like the message,
Right.
And I think that they make sense when we're growing up, but they don't really make sense in the larger picture.
Yeah.
And they're not helpful.
No, we say that, but it's a lot more nuanced than just that. Yeah.
I think in general, like not to generalize too much, but I think in general, we're not really taught how to prioritize ourselves and practice self-care.
Yeah. In your work, are there specific therapeutic approaches that are particularly effective for working with shame?
I'd hate to ascribe to certain therapeutic modalities because, most of us here are generalists.
Yeah.
Therapeutic approaches are individualistic. So
for sure,
what that means is whomever's sitting in front of me, I'm going to adapt to try to meet their needs. But some of the things that I think can work with shame and or trauma are like mindfulness integrated cognitive behavioral therapy.
Okay.
And prolonged exposure. So for people who have experienced a lot of trauma. Other things that work are like social skills training, compassion mind training, so like around self-care and compassion. Using a trauma-informed care perspective and...
what does that mean?
Trauma-informed care?
Yeah.
Trauma-informed care would really be about understanding like the impact of trauma and the origin of trauma and being able to work with people from like a sensitive and culturally appropriate way to be able to put them at ease and make them feel safe and supported, as you work through those events and issues.
Yeah.
Dialectical behavioral therapy, working on emotional dysregulation with people, because oftentimes people who have experienced shame and trauma are very reactive or emotionally dysregulated. So somatic therapies, working with moving into the body, getting out of your head and your negative thought patterns and focusing on the past or worrying about the future. And
so it sounds like there's a lot of different approaches that can be used.
Yeah, the list is endless. Yeah. And there's probably lots that I am not even aware of or not trained in as well,
How do you go about, I don't know if like picking the right one is the right term to use, but like you're working with a client, how do you go about figuring out which approach might be best for them?
Yeah, I think that there's a couple of different ways. I mean, like I said, some of us have a natural propensity towards a certain style or a certain way of working with clients. And oftentimes we bring what I call the person of the therapist into the room, right?
Yeah.
So you are who you are.
Yeah, I think that's inevitable. Yeah.
Yeah, and you meet the client where they're at, right? So you have to take into account who you are, what your natural style is, and then you have to determine what brings a client there, what their goals of care are, and what you think might work for them. And some
Okay.
of it is about obtaining feedback from the client. We do a really good job of that here. You know, we do a lot of outcome measures to track the client's progress, and we ask for feedback about their experience of working with us, and we have dialogue with the client. So that should really inform, you know, whether what we're doing is working or whether or not we should try a different approach.
Okay. The question is, how can someone reframe their experience of shame into an opportunity for personal growth? But is that how we should think of it, of reframing shame?
I think reframing shame is a good way of looking at it.
Yeah.
Because, you know, it's a construct, right, that we've created. It's this internal dialogue that we've created about our experiences. So it's important for us to reframe that in a way that's healthier and gentler and kinder, really. So some of the ways that I think are helpful in reframing shame are in that, you know, developing a healthy perspective around self-acceptance. You know, I'm actually okay. Like, you know, I'm okay with who I am. I'm okay. I'm perfectly okay in this moment. And that doesn't mean that there's not room for growth. It just means that, you know, you can accept yourself and meet yourself wherever you're at with kindness and compassion, and increasing, you know, that understanding and expanding that perspective on how you view yourself in relation to the events that happened in your life. Taking away how those past experiences can shape you, how they've strengthened you, how they've changed your perspective, how they've changed you in regard to how you show up in the world, you know, in positive and negative ways, right? Like we can identify those, and we can have compassion for the ways that they've shaped us negatively, and we can see the resilience and the strength and how they've shaped us in a positive way.
Right.
And working on forgiveness too, you know, like, and forgiveness isn't always about forgiving the person who harmed us. Sometimes forgiveness is about letting go of that blame and those negative emotions that we have in ourselves, and, you know, and again, having some gentle kindness and compassion and self-love, really. Yeah. So some of the ways you might be able to facilitate that with clients too is, as an older person revisiting, say, a trauma experience in childhood, it's like, how can you have compassion for that younger version of yourself?
Right.
Right? If you're in a room with that younger version of yourself, what do you think they needed? Can you provide that now? You know, can you provide that safety and that compassion and that understanding? And sometimes that can be really awe-inspiring for people because they never really think about it in that way.
That specific kind of practice, what kind of feedback have you got from clients who you've worked with?
Initially, reluctance.
Yeah.
Yeah, I would think a lot of resistance.
I can relate. I did something similar with a counselor a few years ago. Yeah, it was hard at first. It just felt very awkward.
I think because sometimes there's a disconnect between who we were when we experienced that event and who we've become.
Yeah.
And so we have a tendency to compartmentalize, you know, shove stuff down, and, you know, and it's just painful. So reconnecting with those experiences can be really painful, but sometimes it can also be very healing and really rewarding. And it's about the act of moving into that self-compassion and operationalizing that, if you will, you know, because it's one thing to talk about it. It's another thing to do it.
Totally.
And that, you know, people, when they come back after having those experiences, usually there's humor, like there's some dark humor in the room where people will say, yeah, you know, I really didn't want to do that. And they may have stronger language and ways of expressing that, but then they'll say that was really powerful and really impactful.
The exact word I was thinking. It was very powerful.
Yeah, I'm glad to hear that.
Yeah. Yeah, that's an important thing for people to understand about some aspects of counseling. It's like, it's going to be really uncomfortable sometimes, but that doesn't mean it's not effective or that it's not going to help you.
Yeah, and I think that's building shame resilience.
Yeah.
Yeah. It's about embracing that shame and learning how to be at peace with it and move into, that discomfort in a really productive kind of way.
We've talked about how guilt and shame are connected. Would you say, if we move to kind of a healthier perspective, is it shifting to feelings of fleeting guilt than deep-rooted shame? Does that make sense? Like, is it, I don't know, for example, let's say, I leave here and I get in a minor car accident and it was my fault. I could feel pretty guilty about that. Or I might think like, oh, I'm terrible, I'm a horrible driver, I should, this was awful, and just really ruminate on that. Is a healthy place to get to more of treating situations like that with a feeling of guilt than shame?
Well, I mean, I think, again, it's complicated, right? I don't want to say that there isn't a place for guilt and or shame.
Okay.
Because as we talked about earlier, I think there is healthy shame.
Yeah.
And we all feel guilty about some things. And nowadays, I feel like we have a tendency to move away from uncomfortable feelings. And I think it's also important to be able to address our uncomfortable feelings and to be able to move through them in a healthy way.
Totally.
So, in your example, you have a car accident and let's say you were distracted, and you hit somebody in your car and you feel guilty. I would say in that moment, that's understandable, perhaps, that you felt guilty.
Yeah, it's normal.
Yeah, but you also want to be able to move into a place of, accidents do happen. Hopefully nobody was hurt.
Yeah.
And it's done, right? Like you've had an accident. You can't correct that. You can correct the behavior that led to the accident going forward, but, also be thankful that you're okay. Is the other person okay? Mistakes happen. We all make mistakes. We're human beings. And how do you move through that in a healthy way?
That it kind of makes me think like that's like in my work and kind of communications and marketing around mental health, that's something we've tried to put out there. It's like, it's not like if you have good mental health, you're happy all the time and you don't experience these uncomfortable emotions, but it's about like being okay with the fact that you are human and do experience these uncomfortable emotions sometimes.
Yeah, exactly. I had a friend once say, life is like trying to navigate a canoe on the river. You've got two banks, and one is a bank of joy and the other one is a bank of sorrow. And in life, we're all going to rub up against both banks.
Yeah.
But our job is to really navigate back and forth and try to stay in the middle, you know?
Yeah.
And that made sense to me. I don't know if it made sense to you, but it
definitely.
It resonated with me, Like we will make mistakes and we are not perfect. And
like mental health isn't about avoiding feeling those things.
Well, exactly. Mental health is not about avoiding those things. And I think everybody experiences joy and sorrow and loss and heartache and pain. And, and they also have joy and prosperity and, connection and nothing in life is constant and things change and fluctuate, just like the weather and our moods and our motivation. It's about being able to navigate it in a healthy way.
In what ways, whether it's talking to someone you care about or to a counselor, like how does opening up and talking about shame help you work through it?
I think people tend to suffer in silence, and in isolation a lot. When we have those uncomfortable feelings, oftentimes it doesn't feel safe to talk about them, or People, like sometimes when I work with individuals, I'm the first person they've told these things to. And sometimes, you know, they've been carrying around this shame and these secrets for 20 or 30 years. So just finally putting it out there and putting it into a room and sharing it with somebody is almost like letting go of that burden or sharing that burden, I guess.
I'd imagine there'd be so many feelings around that. Like, yeah, a feeling of relief, but also like that'd be kind of scary to just have that information out there.
But having it received in a safe space,
yeah,
where somebody can hold you in that moment, and I don't mean hold you physically.
yeah,
I mean hold you in the safety
right
of that moment, right? It's a confidential space, it's a safe space, it's non-judgmental, it's non-pathologizing. You know, there's nothing that you can say that is not going to be accepted in that room, that your feelings associated with that experience are okay.
Yeah, let's say that again.
Yeah.
Nothing you can say. How did you put it? Nothing you can say that won't be accepted?
Yeah, in this room.
Yeah.
Yeah, it's a safe space. Everything that you say is okay in this room. You're okay in this room. You know, I see you. I hear you. I'm here for you.
And that's huge, especially there's, a lot of people who don't have that feeling ever. Mm-hmm. Yeah.
Yeah, and it wasn't your fault. You know, for people to understand that that wasn't your fault, right?
Yeah.
You didn't ask for that, right? You did not deserve that.
Feels like my own counseling session. It's great. Yeah. Thank you so much, Lisa. This has been an amazing conversation.
Well, I really appreciate you inviting me into this conversation.
You've been listening to Living Fully, a Calgary Counseling Centre podcast. Thank you for tuning in. This episode was produced by Nick Here, Louisa Campos, Manuel Montano, Jenna Forbes, and by me, Catherine Hertig. A special thanks to Lisa McIsaac. To stay up to date on our latest episodes, be sure to subscribe. We're available in your favorite podcast app. Living Fully is a production of Calgary Counseling Centre and recorded in Calgary on Treaty 7 territory. Living Fully podcast is not a substitute or alternative for professional care or treatment. Calgary Counseling Centre and Counseling Alberta provide effective counseling to anyone in Alberta with no waitlist and no financial barriers. Find us online at calgarycounseling.com and counselingalberta.com. For help across Canada and the United States, call 211. If you are outside of Canada and the US, seek help from your general medical practitioner.